Right, Jorge, thank you. It is 6:16. As many as 130 million Americans do have a pre-existing health condition. And just to put some context onto this, that is half of all non-elderly adults living here in this country, according to a new estimate from the federal government. And until recently, that status did impact your COVID vaccine eligibility in Arizona. We're talking places, Nick, like Pinal and Coconino counties.
Yeah, it's absolutely right. But the stigmas and shame surrounding that could have a negative impact on the vaccination process. And that's the topic of this morning's ABC15 Health Insider report. Asthma, cancer, high blood pressure, diabetes. These are all pre-existing conditions. If you have one, it impacts your health every single day, but even more during this COVID-19 pandemic. In fact, these conditions could play a big role in whether or not you're able to recover.
We've been studying this disease for over a year now, right? And we know, this should be no secret to anyone, that those that have pre-existing conditions have a 2- to 3-fold increased risk of mortality from COVID. That's pretty significant. Now, luckily, we now have multiple vaccines that prevent severe illness, hospitalizations, and death from COVID, including those that have pre-existing conditions. And that's why it's so important, right? We want to prevent hospitalizations and fatalities for everybody from COVID.
In short, vaccinating people with pre-existing conditions not only saves lives, it also puts less stress on our healthcare system. But if both of those things are true, why is there still a stigma about having a pre-existing condition and getting vaccinated before others?
One of the side effects that one might actually experience is the actual guilt of receiving the vaccine before others, especially loved ones or families. And for those of you that might be feeling that guilt, please don't. If you have the opportunity to get the vaccine, then please get it. Don't hesitate, don't wait. There's going to be enough vaccines for everyone, and you're just as important as everyone else.
I think that is such a fantastic message from Dr. Gupta. He also says if someone asks maybe why you've been able to get the vaccine earlier, simply say, I was in one of the eligible groups. You don't have to elaborate beyond that. You don't owe anyone an explanation. Remember, it is your health. It is your story to tell. If you have a topic or question you want us to help you answer, maybe reach out to our Health Insider team. Email us, healthinsider@abc15.com. Also, you can see the rest of our stories at abc15.com/health.